My name is Amanda Morales, and I will be presenting on my Capstone project, which is implementing occupation-based home exercise programs in an outpatient orthopedic setting. I'll be completing my Capstone experience and my Capstone project at ATI Physical Therapy in Seneca, South Carolina. I will be completing my Capstone experience under the supervision of Nelson Vasquez, who is an OT and also a certified hand therapist. ATI Physical Therapy is a leading provider of rehab services, including physical and occupational therapy. Nationally, ATI is recognized for specializing in a variety of research-based services, including workers' compensation, employer worksite solution, sports medicine, home health, and many others. ATI's Seneca West location offers OT and PT services through personalized treatment plans in order to reduce pain, improve mobility, and reduce future injuries. A large proportion of clients in an outpatient orthopedic setting are not compliant with their home exercise programs. By finding a way to increase compliance with AGPs, also known as home exercise programs, clients will have the potential to improve long-term outcomes as well as reduce the risk of re-injury. The potential outcomes of this project align with the values of ATI Physical Therapy, which includes reducing future injuries, while also providing knowledge on how to improve patient satisfaction and engagement throughout the therapeutic process, which aligns with OT's Vision 2025. The purpose of this capstone is to increase the focus of occupation-based interventions within an outpatient orthopedic setting in order to increase the client's adherence with therapy protocol and compliance with home exercise program. There are 3 pillars of this purpose, which include improved patient outcomes, improved client satisfactions, as well as organization-level improvements. In many outpatient clinics, occupation-based and focused interventions tend to be overlooked. Preparatory methods such as modalities and therapeutic exercises are the most commonly utilized interventions. One of the most commonly experienced problems that I experienced during my fieldwork was that patients tended to get complacent with repetitive treatment protocol. That's where improved client satisfaction comes in. A lot of times patients will cancel at the last minute or just stop coming to therapy in the first place. That's why I believe that utilizing home exercise programs that are valued and purposeful to the client will improve their engagement, which will therefore increase their attendance in therapy and their compliance. Most importantly would be improved patient outcomes. As therapists, we want to see our clients perform at their highest potential and be able to participate in their valued occupations. If clients are compliant with home exercise programs and their treatment protocol, it is anticipated that they will have a shorter treatment duration and decreased risk of re-injury. Lastly, it is anticipated that there will be organizational level improvements. These improvements include decreased long-term spending due to decreased risk of re-injury and shorter treatment duration, and increased clinic productivity. The 3 research questions that I've based my capstone project around are as follows. How will the utilization of occupation-based home exercise programs impact client satisfaction and adherence with therapy protocol in an outpatient orthopedic setting? How will the utilization of occupation-based interventions impact the client's occupational performance following orthopedic injury? And what are perceived barriers of utilization of OBIs in practice? These 3 research questions will be answered with a series of data that will be collected throughout my project. This project will be grounded in theories based around principles of the occupational therapy intervention process model, otherwise known as the OTIPM. The OTIPM defines occupation as a means and an end through the use of purposeful activities. The OTIPM encourages top-down, client-centered, occupation-based intervention. Some pillars of the OTIPM include that clients are unique and engage in activities that yield a sense of purpose. This is why occupation-based interventions are so critical to this project. Through the structured interview and the Canadian Occupational Performance Measure, or the COPM, I will be identifying what are activities that yield a sense of purpose to the client. Additionally, the OTIPM states that engagement in occupation is the center of our profession. OT's primary method for intervention is occupation, and something that we have learned in school and have learned to assert throughout our coursework is that engagement in occupation is what's most important in our treatment. Additionally, the primary intended outcome of our patients is to enable them to engage in occupations they want and need to do. Independence qualifies as the patient's ability to fulfill life's roles and participate in society. I will also be using neuroscience-based theories, including motor learning and motor control. These are both frames of reference that are not typically utilized in an outpatient orthopedic setting. However, there is a theory that a lot of motor learning and motor control is critical in the treatment of orthopedic injuries. Motor learning is a set of internal processes that are associated with practice or experience that lead to long-lasting changes in motor behavior. Interventions within motor learning are functional and enable the client to learn, retain, and transfer the desired skill. Motor control guides the interpretation of how learning or relearning motor patterns occur. Motor control has internal and external factors that affect the client's performance. Internal factors include strength, flexibility, coordination, pain level, and motivation. External factors are considered the environment, context, and materials involved with the said activity. Though the patient does not have any cortical damage associated with the orthopedic injury, after not using the limb due to pain, weakness, or protocol that requires mobilization, the patient almost unlearns the movements that are required of their affected extremity. This project will be using in the form of a case study in order to present 3 to 5 patient cases that incorporate occupation-based home exercise programs. This project will observe and assess the effectiveness of those programs that utilize occupation-based intervention. The project will recruit participants and follow their treatment for 8 weeks. This project will monitor occupational performance, the client's perception of functional ability, and their overall satisfaction with occupational therapy services and their performance. Participants will be recruited through convenient sampling, as I will be completing my Capstone experience treating patients. I'll be interviewing patients for the first 2 weeks of my project, and I'll be selecting 3 to 5 clients, and the clients will have a diagnosis of a non-displaced distal radius fracture of their dominant upper extremity. Inclusion criteria include reading and writing in English and the ability to report occupational performance. Exclusion criteria include surgical intervention of current injury, just because if the client has undergone surgical intervention, it will impede their ability to bear weight or load, and also the presence of comorbidities in the dominant upper extremity that could also impact their occupational performance. Data will be collected during in-person interviews during treatment sessions. Data will be collected at the initial evaluation, at 4 weeks, and at 8 weeks. Assessments to be used include the disability of the arm, shoulder, and hand, the Canadian Occupational Performance Measure, objective range of motion measurements, structured client interview, and also the clients will be expected to keep a home exercise performance log. Both the DASH and the COPM are occupation-based outcome measures that are evidence-based and commonly used in hand therapy. The DASH will be used to measure improvements in the client's perception of occupational performance deficits at the time of initial evaluation and throughout the course of treatment, and the COPM will be used in order to develop goals that are client-centered and to objectively measure improvements in occupational performance. Data analysis will occur through SPSS, and descriptive statistics will be performed because of the small sample size. In conclusion, incorporating occupation-based interventions into home exercise programs is a necessary step in moving towards achieving OT's Vision 2025. The field of OT is consciously making strides towards increasing its use of evidence-based, occupation-based, and client-centered practice in order to stay true to its core values. Through studying the effects of occupation-based interventions through this case study, the project will provide a stepping stone to encourage fellow field members to adjust their practices. This project aims to encourage best practice by determining the extent to which OBIs can improve client outcomes and client satisfaction with OT services.